Okay, so rotator cuff tears. I see these a lot, right? Very, very common. Again, you may not even know if you have one. So, how do we get to the next one? Okay, impingement. Let me get a drink of water real quick. I'm gonna pull y'all back here. Yeah.
Why are the wheels?
Yeah.
It locked. I was like, why can't you hold it?
Okay, so. All right, impingement syndrome. So remember on that rotator cuff slide, we talked about that space, the subacromial space. You want there to be adequate space between the muscle and tendon and that little bony shelf here. I apologize, I had a sinus thing last weekend. So we're gonna see, with impingement syndrome, you're gonna see a reduced space here between these two bones. That's gonna cause a pinching of the supraspinatus tendon, which that can lead to inflammation, pain, degeneration, and eventually a tear, right? And that's a huge issue. So some of the symptoms you're gonna see is difficulty getting behind your back and reaching up your back. You probably get some pain there. We're gonna get pain with overhead activities, right? It's gonna be like a pinching, like nasty kind of pain, you know, up in those upper ranges. Probably see some muscle weakness, some muscle guarding, potentially some stiffness as well. And again, that pinching sensation within the shoulder. So shoulder impingement, very, very common, extremely common. You know, and I was dealing with this for a little while myself, actually. So, okay, so what's an exercise we can do at home, right? That can potentially start to help, you know, fix this problem. There's a ton of them, right? And there's progressions of them, but just one basic one we can do here. So if we take a chair of some sort, don't fall. So I'll take a chair, and I got a pretty sturdy one here. It's going to be in standing, kind of scoot away. So I got a pretty sturdy chair here, right? It's not rolly, it's not going to move on me. So let's say, okay, so my right side, right? I'm getting up here. Ooh, that kind of hurts. It's pinching, right? That's not good. So I'm going to take my hand, I'm going to put my palm, I'm going to be pushing down into the chair, keeping my elbow and shoulder straight here. So I'm pushing down into the chair, and I keep pushing down as I walk away. So push, push, push. Gonna hold it, I'm still pushing down. And not super hard, but just enough. And I'll continue to push down, and boom, that's one, all right? That's gonna help to pull the head of your humerus down a little bit and give you a little bit of space, you know, in that subacromial space. So I'm pushing down, 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 hold for a second or two, and then I'm walking back, all right? And I'll do this on both sides too, because it feels kind of good, right? This isn't gonna hurt you at all. So I'll do it on both. So I'm pushing down, down, down. Gonna get to the end, keep pushing, hold for a second or two, and then walk back. I'll do one more. Again, I'm pushing down the chair, pushing down, hold, and then walk it on back. And y'all can do this on like a countertop or like a kitchen table, you know, anything that's, you know, somewhat this height. But again, just not a rolly, because this thing can, you know, just fling on you, and that's, you know, gonna hurt you more than anything else. So shoulder impingement. Let me pull my PowerPoint back up. I got it. Screen share. Okay, so shoulder impingement, very common. I see it a lot. Shoulder fracture is the next one. I've actually seen this more than I thought I would here in the clinic. It was kind of surprising. But you're gonna see this from, you know, a fall, like potentially a fall on an outstretched hand. You're gonna fall on your shoulder because you like trip at night, go in the bathroom or something like that. You can also see it from car wrecks, like MBAs, high energy traumas. Here you're gonna see severe pain, more than like you're not gonna move your arm. There's gonna be swelling. Potentially you'll see like a deformity of the shoulder. So if this is an issue, go get it checked out. Go get an x-ray, go see your doctor. Because then potentially they're gonna have to put you in a sling and immobilize you, depending on the severity and location of the fracture. Because we can see it here on the collarbone. You'll see this a lot in football players because they're always hidden with their shoulder, so it can crack. Less commonly, you're gonna see a complex fracture in the scapula. So that's gonna be a nice surgery there, more than likely. And then we can see it at the humerus as well, which is the long bone. You can see it at the neck because it's kind of thin there, or you can see it at the head of the humerus. You know, so again, you know, surgery or sling use, you know, let the fracture heal. And then afterwards, come to PT, because you're going to have, you know, anytime you're immobilized, you got to get that shoulder moving healthily and functionally. You know, so we'll start with just some gentle mobility, some pain relief stuff, get you moving, and then start working on your strength, so you can be functionally strong through your ranges of motion, because, you know, that's what you want for a healthy shoulder. So shoulder fracture, I see a lot of MVAs here in Tucson. It's kind of surprising, honestly. Another one, shoulder problem, is a frozen shoulder, and this is kind of a funky one. They don't really know what causes it, but essentially it's like a freezing of the shoulder capsule where it's going to thicken and tighten, and unfortunately it causes a lot of pain too. And it goes through 3 stages sequentially, and it could take anywhere between 1 to 3 years for it to cycle through those 3 stages. So the first one's going to be the freezing stage. You're going to start getting a lot of pain in the shoulder, and your range of motion is going to start going down. And you may have not hurt your shoulder. And this may just start happening randomly. You're like, what in the heck is happening? So, maybe you're frozen shoulder there. After the freezing stage, we're going to see the frozen stage, where your pain is going to start to go down, but then your range of motion and function are going to continue to decrease until we get to the thawing stage, where your range of motion and function start to gradually get better and better until essentially you're back to normal, hopefully, right? So frozen shoulder, I've seen this a couple times. Got a couple of people now with it as well. So what do you want to work on, right? Well, first thing is try to get your mobility back and try to maximize the mobility that you have. So what's an easy thing that we can do at home? Table slides, super easy, right? So we're just going to work into a little bit of flexion, do some gentle stretching, and try to maximize the motion that you got. So we got a little setup here. So for y'all at home, if you have like a kitchen table, is usually pretty good with the kitchen chair. And I'll take like a little towel for decreased friction. I gotta get my towel, hold on.
Here it is. Vince?
So this is our little makeshift table here. So say my right side, all right, I'm starting to get, I'm starting to get some, you know, motion decrease. And if you have any kind of motion loss, then this is probably a really good one to start with. So I'll start about here, make sure y'all can see. So I'm sitting in my chair, you know, I got my table here. This is gonna decrease my friction. So I'm gonna use my body to lean forward and say like, okay, I start to get a little bit of tension there. Okay, then I'm gonna hold and light. I keep everything for stretching light, because aggressive stretching, really, it doesn't do much. It's gonna make you lock back down, really. Hold for a couple seconds and then come back. I'll do a couple. You know, at home, 10 times, 10-second hold, give or take. Do a little slide and hold. And then come on back. There. And I like palm down. I mean, you can do thumb up if you want to. But to me, this is comfortable, and I have pretty good control of the towel. So I'm going to slide, slide, slide. Lean forward. And then come on back. So it's going to emphasize shoulder flexion, right? And try to gain a little bit of range back there. So just an easy one that y'all can do at home. And then one piece I forgot about frozen shoulder is, you know, one way to identify it, I'm going to switch chairs. In the clinic here is you will see a pattern of motion loss in the shoulder. So what we're going to see is, gosh, I can't remember what I'm talking about. It's abduction. No, I apologize. It's going to be external rotation will be the greatest motion loss, followed by abduction, followed by internal rotation, right? There's going to be a capsular pattern of motion loss. So that's something we can use here to identify a frozen shoulder issue. So, you know, if you think you got this going on, come see a PT and let's work on it. Okay, so that covers, and that's not all the shoulder problems, but it's just a starting point of talking about some common ones that I see. So, but there are a bunch of others. So physical stress there, it's just something I thought was really important that we could throw in there. And essentially what this is saying is if y'all are not exercising, if you're not taking care of your bodies, if you're not, you know, moving, then your injury threshold is going to go down, right? So if you look on the left here, so you're going to, a lower stress is going to put you at risk for injury versus if you're taking care of yourself and strengthening, emphasizing normal posture and doing all the right things. So you see on the right, if we're exercising, building muscle mass, bone mass, we're doing all the right things, you got a decreased chance of injury, and that's what you want, right? Because if this guy on the left here gets hurt, it's going to be a battle just to get back to that pre-injury level. So you'll make your life easy on yourself. Prehab, do things you're supposed to be doing. Take care of your body because you got one shot at it, right? We don't want to see, non-functional, people at the later years. So super important, super important. And then tissue healing phases I also thought was really important to throw in. So there's 3 essentially. So you got the inflammatory phase. So say like, I fall on my shoulder, ouch, it hurts. So initially it's going to be the inflammatory phase. The first couple of days, you're going to see, warmth, redness, swelling, pain, loss of function. Pretty typical. So what do we hear like the Rice principle, right? Like, oh, that's the best way. I'm going to rest, ice, compression, elevation, which is fine, except for that rest part has been changed a little bit, where you want to do gentle motion and optimal loading for the injured tissue. And that's been shown to be much more optimal than just resting and immobilizing. So, but also that's why you come see a PT, so you know like what to do so you don't re-injure. Because if you load too much, you're just going to keep damaging. So doing the right amount, it's going to be the most optimal. So we got to make sure it is the right amount. So after the inflammatory phase, we'll go into the next stage, the proliferative phase, which is the next like 3 to 20 days, give or take. That's where we're going to start to see scar formation, laying down collagen. Repair of the injured tissue begins. That's when we can start to gently stress the tissue, stress the injury, and begin the healing process. As we move into the maturation phase, we're going to start to see, full restoration of the tissues, return to function essentially. And that can take a while, right? It can take, 9 to 1 to 2 years. So we need to be proactive about doing things. Okay, we're getting up to our time limit. I'm kind of talking a lot, sorry. So we've got I got a bunch of home exercises here, so we don't have a ton of time. We're gonna go through, how much time we got? Let's go through the first 3. Yeah, that'll work. So just general shoulder exercises for shoulder health, right? And I think I have like 10 in here, something like that, but let's just go over the top 3. So the first one, but we'll send you the PowerPoint. Yeah, you all have this available to you. So first one, just rotator cuff strength. It's an advancement off of the isometrics. TheraBand resisted internal external. We're going to show you here in a sec. TheraBand's super awesome, really great therapy tool. Y'all should invest in them because you can do a ton of things with TheraBands, and you don't need much resistance, just light, super light. And I'll show you here the proper technique for it. So I got my light TheraBand here, and then move the camera down. There we go. So we made kind of pre-made loops here. So what you can do is like tie a loop and then put it in the door and lock it down, so then you'll have the resistance here. And I'll just tie it real tight. So again, it's gonna be the same motion we did at the wall, external rotation here. So this is gonna be external rotation strengthening. Again, you can do 20 to 30 repetitions, or I guess between 10 to 30, depending on your level here. And I can show you from a side view, my shoulders are down and back, and I'm rotating this way. Common problems I'm going to see is people extending at the elbow here, right there, but that's going to be more tricep. It's not going to be your rotator cuff. I'm also going to see people kind of rounded here, like doing this jazz, all this is, but yeah, no good, right? So we want to be shoulders down and back, nice and tight form here. External rotation strengthening with the band, right? Then we got to go the opposite way. Again, I would turn around, but just so y'all can see, there's going to be internal rotation. So I'll start in an external rotated position and then rotate to the inside this way. Again, you can do like 3 sets of 10, something like that, to your tolerance, right? And rotate. And internal, external rotation with a band. This one's super light, so I'm a big fan. Really, really good, just general shoulder health strengthening. The next one was, I don't need to see that, rows. So again, we got the bands here, but you can use the stretchy bands and maneuver it to how it's going to be good for you. So we'll go here, and I'll see, pull it back just a little bit. Okay, so I got my bands here. I'm going to set my shoulders down and back I'm gonna pull and squeeze my shoulder blades together and then back. Here. So it's retraction, right? Like we talked about at the start. Pull and squeeze and back. Common problems, we're gonna kind of see this, the pull up and back. So that's elevation. We don't want to do that, right? We're trying to work on down and back. I'm just gonna set my shoulders down and back. And then pull again, really light resistance, pull and tuck. Maybe do like 3 sets of 10, you know, like once a day or, you know, 2-3 times a week. Yeah, and pull. There. So the motion in the back, I don't know if you can see from the back, it's gonna be squeeze. So you don't want to be out here, right? Everything's tight. Tight, tight, and tucked. Rows. Go to a wall for the last one. It's gonna be wall push-ups. And some of y'all may not be ready for this one quite yet. So I'll put my hands, so just find, you know, the wall. I'm gonna put about shoulder width, about chest height. Put both your hands down. If it hurts in this position, it feels like it's kind of pushing back, either try to put more weight right through here, your palm, or you can make like fists on the wall with towels. That'll be a little bit easier. So what we're gonna do is come on down, pinch your shoulder blades together at the back, and then drive out. Again, I'm here. Everything's tight here. I'll see a lot of this nonsense, and that's just gonna put more strain on your shoulder, right? It's gonna be more triceps. We want to emphasize the shoulder blades in the back. So again, we're gonna go here, a couple steps off the wall, tuck, and then push. And you don't have to come all the way back here. I'm just coming back to neutral and then driving back out. Here, tuck, and then drive. If that's too easy, once you get to like 30 reps, it's too easy. You can come down to a little bit more of a lower surface. And again, I'm gonna come down, tuck, shoulder blades together, and then drive back out. So push-ups. Not too bad, right? Come on back over here. Do we have time? 5 minutes. Okay. I think we got a little bit more time here. So let's go through. Like a couple more then. Let me see. What we got? So we did internal, external, rows, push-ups. Okay, prone W. So what we can do here on the floor. So again, this is going to be more of a floor, like on your bed. You can do it too. So come on down. Here on the floor. Again, I'm going to take my shoulders here and just rest. And you can take like a towel and rest it on your forehead if you want to. So over here, I'm going to pull my shoulders up, pull down and back. Hold for a second or two, and then relax. Again, we'll pull up, pull down and back, then back again. You know, you can do like 2-3 sets of 10, something like that. So I'll show you 2 more. So pull up, down, back, and you can pull your head up or just rest it down, whichever one you want. And then back down, 1 more, and pull up, down and back, and then relax. So again, like on your bed, on the floor, whatever is comfortable for you. Nice and easy. Let's just do 1 more real quick. Then we can answer questions. And then next one. Okay, then chin tuck for improvement in forward head position. This one can be done in either seated or on your back. Or I can do multiple positions, but these are just 2 starter ones for you. So if you're gonna do it sitting, be up in a chair, be up nice and tall. Again, shoulders down and back. Then what you want to do is take your head, then you're going to tuck it back, hold for a second or 2, and then ease off. You should kind of create like a turkey neck here, make like that double chin. So we'll pull, tuck, and then relax. So common problems I'm going to see here is going to be, you know, we'll nod all the way down. That's just flexion, or you're going to just look all the way up like this. So that's extension. What you want to do is do straight line, pull back, hold, and then relax. And so that's going to take your ears and pull them back and put them more in line with your shoulders. So again, we're emphasizing a little bit more of a normal posture with this exercise. So chin tucks, you know, easy, important. So I think that's about our time. So let's go questions. I think we need to pull up the chat here.
I'm trying to find it.
No, it's going to be to the right. See the chat. Okay, let's see. Yeah, so if y'all have questions, let's see. Yeah, I'm not sure. Yeah, post your questions into the chat if you have them. Yeah, and remember we're offering a free consult, y'all, and then Miss Paula is going to help y'all get that set up. I think we have people standing by too, if y'all want to. That's fine. Okay, let's see. Let's see. Is there a diagram for all of these so we can remember them later? So we're going to send you the PowerPoint, but I don't have a diagram of the ones we did for the specific diagnoses. Y'all would have to come see me. They'd be able to share it. Yeah, unfortunately. Is swimming helpful for rehabbing shoulder pain? For rehabbing shoulder pain, probably not, because you're getting a lot of that overhead and internal rotation of the shoulder. So if you're having pain with that motion, it's not going to rehab it. It may actually make things worse. What is a biomechanical evaluation? It's looking at the mechanics, the normal mechanics of the shoulder, like we talked about, like the glenohumeral and scapular motion together, and making sure that that is normal. And we're looking for dysfunction within that, right? So maybe you have like a tight pec minor that's throwing off your scapular movement or positioning, that's causing you the pain. So then we come in and then try to address that, right? And address your dysfunction so we can get you back to pain-free, and try to normalize your mechanics. Is popping a concern when doing any of the exercises? That can, yeah, absolutely. That can mean that, something's, abnormal or dysfunctional within the shoulder. So maybe you got like a tear, there's kind of like a labral issue going on. So that's something you should definitely come, see us for. Let's see what else. I'm also wondering about popping and crunching when raising my shoulder. No pain is okay to do exercise stuff. Yeah, general rule of thumb, as long as it's like pain-free, you should be fine. Popping, it could be just a little bit of arthritis too, or just like some rubbing of structures. But if it really concerns you, yeah, come and see us. But it doesn't always mean bad. So if I have a tear in my labrum in the 9 to 11 o'clock position, I did PTs with the guys from January to March. Pain used to go down my arm. Now I centralize more in the back part of the shoulder. I'm not sure if there's a question there, but it sounds like you got something going on. So, yeah, so schedule a consult for sure. We can talk about it. I don't know if there's any more. Did I miss any? Type something in the chat, guys. You want to, if you want a question answered. Let's see. I think that might be all of them. So I just see y'all's names here. Yeah, so hopefully, it was informative for you guys. Hope you guys got something out of this. Just gives you guys some basics. Got a new message. Let's see. But again, there's so many things. The shoulder is very complex, which is I really like it. Thank you, Dr. Vince. Very interesting, informative. Oh, thank you. That's very nice. Oh, so Ms. Paula said, write your name in the chat if you want a free consult, and we can help get that set up for you. Okay, I have a proximal fracture of the humerus from falling on an outstretched arm. Sorry to hear that. I'm getting a lot of clicking in my shoulder. What does it mean? Could mean a lot of things. Have you gone to your doctor? That's my question. Have you gone and checked out? That's what I would do, first line of defense, and see, yeah, especially if you did have a fracture. I couldn't tell you what the clicking is exactly just from, information you give me there. But wonderful presentation. Oh, thank you so much, guys. I appreciate it, guys. I would like a consult. Okay, your permission. Yeah, hopefully, we're just trying to help you out. How is a reverse shoulder replacement different? So you got the typical, the ball and socket, and they do the reverse. It's a ball and then they put the socket for the arm. And I've seen it a couple of times. And the rehab's a little bit different for that. There's a little bit different restrictions, but we do PT for reverse shoulders. Already having shoulder work at bicentric last arm. Nice. Console. Okay, nice. Okay. Yeah, I appreciate it. I appreciate y'all's time. I really do. Yeah, thank you. Now I'm turning over to Miss Paula here. She'll answer any questions you guys have. But yeah, have a great Saturday, y'all.